Teachers opens the door, but must enter by yourself. Good morning, one and all. Thank you all for finding time and being here today's webinar. Myself, Ms. Julia Devi, lecturer on behalf of Mental Health Nursing Department, Columbia College of Nursing. It is my great opportunity to conduct this valuable session. Great. Our today's topic is on post-COVID stress management. Before moving ahead, I would like to pray Almighty to make the session success, and I would like to give honor to our beloved chairman, Mr. S.K. Subramania Reddy, Columbia Group of Institution, our secretary, Mrs. Usha Reddy, and Mr. Raghunath, Director, Columbia Group of Institution, Dr. Dinesh Selvam, Principal, Columbia Columbia College of Nursing, Bengaluru. Now, I would like to invite Dr. Dinesh Selvam to give welcome address and to say a few words on highlighting the theme.
Yeah, good morning, everyone. It's going to be a good day seeing you all on this webinar that's being organized by Columbia Group of Institutions, the Department of Psychiatric Nursing and the Columbia College of Nursing coming out with this webinar on post-COVID stress management. So on this occasion, it gives me immense pleasure to welcome one and everyone for this webinar. So first of all, I give my respectful welcome to our managing trustees, our chairman, dear Mr. Subramania Reddy sir, and our secretary, Mrs. Usha Reddy ma'am, and our director, Mr. Ranganath sir, for this webinar. And it's my duty to also welcome our eminent speaker, Dr.Sharmila, the principal and professor at Dayananda Sagar institution. She is the principal of College of Nursing Sciences under Dayananda Sagar University. Ma'am, it's great pleasure to have you on this day. And we are really honored on behalf of management. We welcome you with the words of okay for this webinar. And this webinar, also we have participants from all over the, and there are around 500 registrations, but we are accommodating around only 100 people in the Zoom link, and it's also being live in YouTube. And all the participants and our faculty and our team behind organizing this webinar, I welcome you all for this day. And the topic what we have selected for this webinar is post-COVID stress management. Yes, COVID-19, which taken away a lot of lives in the world and which affected a lot of people with a lot of difficulties, and still it's going on. So as soon as we hear the word, COVID-19 pandemic, there is a fear, there is a worry, there are a lot of stress that is surrounded with everyone in this world. So this COVID-19 pandemic have negatively affected many people's mental health, which no one can deny. and it has created a lot of barriers and a new barrier, new challenges for the people to live their daily life. And many adults, even in young age, young adults, apart from the older adults, that they are having worsening their condition of chronic illness, and many young adults are being reported with more negative impacts on mental health and their well-being, especially difficulty in sleeping, difficulty in eating, and they show a lot of symptoms of anxiety, depression, low self-esteem, substance use disorder, and the suicidal thoughts. See, all this COVID pandemic has left us where surrounded with, again, I want to say, fear, worriness, and stress. So that's what sparkled for selecting this particular topic. And we have an eminent speaker, Dr. Sharmila, who is going to talk about what as a nurses we can do to after this post-COVID stress management. So this talk is going to highlight all the nurses who are attending here, who are in the clinical area and who belong to mental health nursing department, to carry out a lot of points on how to talk with the patients and to the community about to identify the stress that is surrounded the people after COVID and to do what kind of management we can do them and counsel them. So I welcome you, ma'am, to have more and to know more about the topic, which all the participants are really eagerly waiting for the topic of the day. Thank you. Over to Julia.
Thank you, sir. Now I would like to call Ms. Fiba to introduce today's speaker, Dr. Sharmila.
Good morning, everyone. Now I feel privileged to introduce today's speaker, Dr. Sharmila. Dr. Sharmila is the principal and also professor and HOD of psychiatric nursing at College of Nursing Sciences, Dayananda Sagar University, Bangalore. Dr. Sharmila has completed UG and PG program in Homeology College of Nursing, Chennai. PhD program also completed at Savitha University, Chennai. Ma'am has taken a great role in nursing profession. Dr. Sharmila worked as clinical instructor, assistant lecturer and lecturer at Homeology College of Nursing, Chennai from 2000 to 2005. Ma'am has started her professional career in psychiatric nursing as lecturer from 2006 and continued as assistant professor HOD of psychiatric nursing in Padma Shri College of Nursing till 2013. And also Dr. Sharmila dedicated to nursing profession as vice principal for 3 years at Padma Shri College of Nursing from 2013 to 2016. Apart from the academic, Madam worked in clinical setup as nursing senior officer at Apollo Hospital in Chennai. In 2017, Dr. Sharmila has taken the part in RR College of Nursing, Bangalore as principal, HOD and professor in psychiatric nursing for 1 year. Currently, ma'am is completely dedicating her service as principal in College of Nursing Sciences, Dayananda Sagar University, Bangalore. Ma'am has participated many more conferences in workshop at state, national and international level. Ma'am has participated in paper presentation at national and international level and also published articles in national and international journals. As an active researcher, Dr. Sharmila has conducted more than 3 research in psychiatric nursing. From my bottom of heart, I'm speaking you that you are the one role model to us because of abounding service in the profession.
Thank you, Fiba. Before starting this session, I request all the participants to participate actively throughout the session. If you have any questions during the session, feel free to write in chat box. Without taking much time, I would like to invite Dr. Sharmila to start the session. You can start session, ma'am. Sharmila, over to you, ma'am.
Thank you, dear, for giving a wonderful welcome speech. And at the outset, I would like to, first of all, I would like to thank the chairman, Columbia Group of Institution, Mr. Subramanya Reddy, the principal, Dr. Dinesh, and the staff, and also especially the Department of Psychiatric Nursing staff, the Department of Psychiatric Nursing, for taking up this wonderful topic, because which is very, very important for the present scenario. As we know, all of us are wondering what is going to happen. All of us are finger crossed, like how are we going to face each and every day? Because first wave came, then we didn't know that there is going to be a second wave. Now all are speaking about the third wave. More than the physical symptoms, we are awaiting what is going to happen each and every day. Than all of that, all of us are setting in with fear and anxiety. So presently, more than the prevalence rate of the COVID, the prevalence rate of psychiatric problems, psychological problems are increasing more and more. So I also feel that this is a very important topic. This is the right time to talk about this. Most of them would have underwent COVID. Most of them are fearing about whether I will be getting COVID or not. Most of them would have already taken vaccine. Most of them have not taken vaccine. So many things are going in our mind. So I felt this is the right topic to talk about in the right time. So once again, I take this opportunity to thank the Department of Psychiatric Nursing to put up this topic to talk on this day by the virtual mode. So without taking much time, I would like to move on with the topic. I would request the host to just put on the full screen so that it will be, I think the screen is visible for everyone. Am I audible?
Yes, ma'am.
Yes, ma'am.
Okay. Thank you so much. So without taking much, I request, because when you mute, it is getting mute for me too. I request the host to be kindly co-host me, otherwise I will not be able to, when you're okay. Next slide, please. Next slide. Next slide. The coronavirus 2019 is pandemic and be stressful for everyone. So what is making stress? The fear and anxiety about the COVID is making stress. So fear and anxiety about the disease causing strong emotions in adult and children. Public health actions such as which is making more and more fear and anxiety, social distancing. There is lockdown, which makes feel so lonely, so which increases the stress and anxiety. However, we feel that these actions are very, very important to prevent pandemic. There may be hospitals, so many hospitals, doctors, nurses are there, but still we have to take up preventive measures from our side, which is very, very important. That is a social distancing, isolation, or keeping away from ourselves, trying to wear masks, preventive measures, washing hands. All those only will keep ourselves. So, but still we feel so fear, and that fear and anxiety causes more and more of stress. Next slide, please. Next slide. Next slide. So the COVID pandemic has likely brought many changes. What are the changes this is making is to live our life with uncertainties, because day by day it is unpredictable what is going to happen. Altered daily routines, financial pressures, and social isolations. What is this financial pressures and social? Many of them have lost their jobs due to unemployment. There is a social isolation. So worrying about getting sick, how long the pandemic will last, and what the future will bring about, what is going to happen in future, how are we going to face each and every situation. So information overloaded, how are we getting information overloaded due to the social websites like Facebook, LinkedIn, or the other websites? We get more and more informations. People will get less information but talk more and add on more of, and you exaggerate the conditions. So information has been overloaded. A lot of rumors and misinformations make our life feel out of control and make it unclear what to do. So that becomes more and more fearful. So day by day what happens is, like when even a layman speaks, this is going to happen. Like once we start up with cold and cough, immediately they say that you will end up with coronavirus, or you will develop with a lot of complications. That becomes more and more fearful. So we start taking a lot of attempts, or we become sick, or become more and more not taking up a lot of stress into ourselves without getting clear informations. Next slide, please. Next slide. There is a lag in changing the slide. Can you just please quickly change the slide? Yes. So again, like I said, fear and anxiety is becoming more and more stress. So what happens is, stress is a normal physiological and psychological process which each and everyone will undergo. But during this pandemic, the stress becomes more and more, as I have already said about that, because of the social isolation, the distancing, unemployment, financial pressures, all those things keeps fingers crossed, and stress becomes more. But this is a psychological and a physiological reaction which demands a life. But everyone, we all of us should know how we are going to handle the stress during this particular time. So everyone reacts differently to different situation, and it's normal to feel stress, worrying during this crisis. This is normal. This undergoing this fear and anxiety, stress is normal, but we should know how are we going to handle this stress? How are we going to manage this situation? How are we going to cross about this? So there's a multiple challenges daily, such as effect of COVID-19 pandemic at times can push us beyond our ability to cope. There are people we'll have a lot of abilities to cope up with people. There are people who are not able to cope up. Our people are learning to cope up with stress. How are we going to go about this or cross this stressful situation? One is, there are two category of people who have already crossed COVID-19, who have underwent COVID-19, and the people who are not exposed to COVID-19, but still you are getting scared whether I'm going to get exposed, whether I'll be getting affected or not. So people who have come out of COVID also are getting fear and anxiety whether I'll be affected or what, or due to the physiological changes or the complications which is happening in them, that also sets fear and anxiety. So there will be there will be multiple feelings which takes up within them. Like anyway, somehow I came out of COVID, but still there'll be fear will be there in them. And people who have not come across or who have not been diagnosed with COVID have a fear, like how I'm going to come up. Only thing is, we should know how are we going to cope up with these situations. Next slide, please. Next slide. So during this COVID-19 pandemic, one may experience stress. So what are the things which we are going to face as fear, anxiety, stress, sadness, and loneliness? As we know, loneliness, we are not able to meet our friends, we are not able to talk or meet everyone, or we are being isolated at home. And mental health disorders, including anxiety, depression. When I'm not, this is the second phase. The mental health disorders, including the anxiety and depression, it can worsen, because when we are not able to cope up, which is going to affect our day-to-day activities of daily living, then it will get extended to the anxiety and depression, which is going to cause a mental disorder which will worsen. So before we could set into the severe condition or the psychiatric problem, we should take up at the first stage. When we have this fear and anxiety or the stress, we should be able to cope up, or we should learn how to cope up with this stress and how to come out of this. Next slide, please. So before setting the severe condition. Next slide, please. So as we know that everyone is the whole, it is not only for us. We may be thinking why it is happening to me, why it has to happen for us, or why it is only for my family members. It is not like that. It is for the whole universe. The whole world is suffering with deep loss, because by this time we would have come, would have come to know many millions of people are affected and hundreds of people would have been killed. So the whole global has been with economic disaster, and also all of us are suffering with this suffering that accompanies it. And for almost everyone there is an anxiety, fear, at least some of the time. But this anxiety, fear depends upon each and every individual. How do they take up this stress? How are we going? How are you feeling about it? And this has because many of them would have lost their homes, some of them due to unemployment or financial pressures, all those things, they would have feel still more and more their stress will be more. So when the stress lasts for several days, make one miserable and cause problems in daily life, finds it hard to carry out the normal responsibilities, it's time to ask for the help. So as I said in the previous slide, this is stress, fear and anxiety is a normal psychological problems, but only thing is we should know how are we going to take up, or how are we going to cope up. Suppose if you're not going to take up in a right time, in a right way, if you're going to leave it like that, that will affect to our activities of daily living, and which will end up in the psychiatric problems. Next slide, please. But each and everyone responds it differently. As I said, few may not have that sort of pressure, but still only they have fear and anxiety. Few would have lost their job, they'll have fear and anxiety of how I'm going to take care of my family. So response to stress during this COVID-19 pandemic can depend on the background, the people, the family support, where are they living, how about their living situations, their culture, social support systems from the family and the friends, financial situations, health and emotional background. Few may be already suffering with some of the medical conditions, and along with that, that itself would have already set in with some sort of fear and anxiety. Along with it, the extra burden of setting in with whether apart from this I'm going to getting exposed to COVID-19, an emotional background. Some will have an emotional instability, not able to cope up with it, and community where do they live in, and other factors. So it depends upon each and every individual is unique, as each and everyone know. So it depends upon the background, the social support systems, how are we going to cope up with these situations. So each one reacts differently to these stressful situations. Next slide, please. People who may respond more strongly to the stress of a crisis include people who are at risk for COVID-19, who are at risk like elderly, or who are already been diagnosed with other medical conditions or other comorbid conditions like diabetes or other cardiovascular diseases, and children and teens, people caring for family members or loved ones, people who are like family member, one of the family member is affected with COVID, and the other family member who is going to take care of them also are prone for. The frontline workers who are taking care of the patients at the hospital, then essential workers who work in the food industry, because as we know that only even when every lockdown has happened also, there are people who are the Zomato people, the Swiggy, who comes and delivers food for you, people who are preparing food for us and sending to each and every places who are in need. So and apart from that, the pre-existing mental health problems also. So these are the people who are more strongly prone for stress. Next slide. And then again, people with history of substance abuse or having a substance use disorders, people with the major changes to their employment, major changes in the employment, many of them would have got loss of job or unemployment or less salaries, and then people with the disabilities or developmental delay, who are socially isolated from others, people who are already socially isolated from others, or people who are already in depression, like as I mentioned about the mental health condition, they're all highly prone for. And people with some minority groups who do not have access to the information in their primary language, they may not be able to understand. People who are homeless, think about the people who are homeless, who will be able to, we are talking about covering ourselves, about the mask, about the vaccine, about the hand washing techniques with all the sanitizers. How are they going to manage them when they're not able to take their a basic the 3 times food or 1 meal per day, how are they going to protect themselves? People who live in group settings where they're not able to isolate themselves, so these are the people again more for stress, and during this they will be more prone for stress during this crisis situation. Next slide. Next slide, please. So what is the normal feeling? Previous slide. Previous slide. The normal feelings experienced by people is changes in sleep and eating pattern due to fear and anxiety. Normally, when I think that slide is changed. Can you go to the previous slide, please? The previous slide. Previous slide. Sorry for the group. A slight technical issue, I think. Sir, it is not the next slide. It's the previous slide. The previous slide. Yes. No, the previous slide. Normal feelings experienced by people. I think the slide, yes, slide number 12. Slide number 12, yes. So what are the normal feelings experienced by people is changes in the sleeping or eating pattern. When we normally have this fear and anxiety, we have disturbance in sleep and eating will not be able to sleep or will not be able to concentrate, will not be able to take care of any that concentration all will not take place when when we wanted to do something. So worsening, and apart from this, when these alters, when the eating and sleeping pattern alters, automatically what happens is our physical health starts worsening. So worsening of chronic health problems, who have already have the problems also will get start worsening. Worsening of mental health conditions. Why it becomes when you don't have a sleep and eating pattern properly, what happens is our concentration gets affected, where thereby will not be all our works get stagnated, all our works are being lagged or piled up. So still more will not be able to complete our work. Worsening of mental health conditions, increased use of tobacco or alcohol or other substances. This enhance or leads in increased use of tobacco or alcohol or any other substances. Next slide, please. Next slide. The feelings experienced by people recovering from COVID-19 or ending home isolation. So this is the main thing. People I've already told who have come out of I think you missed out a previous slide. Slide number 13. Slide number 13. Previous slide. Previous. Next slide.
This is the
And
next slide.
apart from that we have the people may feel guilty that they are not able to complete their work. So this guilty happens, or not able to take their children are at home. What happens is when they're mentally disturbed or when they have all this stress takes place, they'll not be able to take care of their children at home or the dependents at home. They'll feel so bored. They keep them isolated. So all these will happen. People who are coming out of COVID, is there will be mixed feelings will be there. One is, as I've already mentioned, one is they would feel that yes, I've come across. There are people who have two ideas. One is I've come across COVID-19. I've been diagnosed. I've come out of it. So henceforth, I will not get. That is a wrong information. And then one is still, but followed by that, they'll have complications will be there, or still more they'll have certain body pain and all other things. So one is that. Another, so that is the mixed emotions, including the relief. And next one is fear and worry about one's own health and the health of loved ones. Then stress from the experience of having COVID-19, monitoring oneself and being monitored by others. This is very, very important. What happens is, even you have come across it, you keep on thinking, even if there is a small pain or a small change in the if you have a slight cold or cough, again you feel that maybe it resembles the same symptoms. One is monitoring of cells, and one is monitoring by others also. Oh, this person has been come out of COVID, but still we will keep will be away from this person. So that also being monitored by others also. Then sadness, anger, and frustration, because friends and loved ones have fears of getting this disease. So one is we have the fear of that I'll be getting the disease. The other one is, if I go near this person who would have come out of it, but still you will still have the fear of, if I go with this, be with this person or go and talk with this person, again I also will be getting affected. So that also, so because of that sadness, anger, fear, and anxiety, all those things keep sets in. Excellent, please. Guilt about not being able to perform the normal work or parenting duties, as I've mentioned, will not be able to take care of the dependents. Worrying about getting reinfected or sick again, when a small symptoms reappears again, you will be getting worried. Or they would have got the information saying that people who have already been affected or been diagnosed with COVID, they would have heard that once again it has been diagnosed with COVID. So again they'll be worrying about whether I'll be getting reinfected or sick again. And other emotional and mental changes already would have taken place because of fear and anxiety and the stress. Yes. Next slide. Next slide, please. So what are the behavioral changes which happens in children? These are the behavioral changes: excessive crying or irritation in younger children, returning to behaviors they have outgrown, excessive worry or sadness because the children are not being able to go out, they are being completely isolated, being at home under control, not being allowed to go and play out. Unhealthy eating and sleeping habits, unhealthy eating and sleeping has not able to sleep, or long term usage of mobiles or the gadgets, and they'll not be, their sleeping pattern will be altered whole night, overnight. I would have heard from many people saying that whole night they watch movies again, all those things. Then irritability and acting out behaviors in teens because they're not able to go out or meet friends, are not able to perform what are the activities what they were regularly doing. Poor school performance or avoiding online classes. Why online classes? Many children have complained about they've developed with eye pain because of the eye strain, the headache. Poor school performance, not able to perform what is being expected because it is an unusual way of getting exposed to the screen. Difficulty with attention and concentration, not able to, because sitting at home monitoring only the looking at only the screen. Unexplained headaches and body pains because constantly getting posed or in one position. Certain schools always they have been monitoring the children, even where they have to keep their videos on, audios on, so that they keep asking, checking with their attention throughout sitting in one place, because in the school you know how it takes place in a school and how it takes place in front of a screen. So unexplained headaches and body pain, avoidance of activities which is enjoyed in the past, then use of which makes them to go in for use of alcohol, tobacco, or other drugs. So these are the behavioral changes which takes place or which can be observed in children. Next slide, please. What are the behavioral changes in the adolescents? Adolescents may experience significant changes in their sleep pattern, not able to sleep or change in the sleep pattern, isolate themselves more, frequently appear irritable or frustrated. I know like each one of us would have undergone with this irritable and frustrations or getting isolated themselves, because not able to, we have to be within ourselves, within the same house or in the same room for a long time, not able to go out, not able to, when you go out again, a fear of whether I'll be getting exposed to COVID, or not, the shops are not open to go out and have a chit chat with a friend, or not getting exposed. Then next comes the social isolation, all those things. So these all makes irritable and frustrated because we are all totally cut off from what we were being exposed to and what we were enjoying already. Withdraw from the usual activities or engaged more frequently with technology. So no other go, when you're all being cut on with all those things. Already we were frequently using with gadgets, now it is becoming more and more completely with the gadgets. watching movies or watching with the social websites. One is watching with movies is okay, we are getting diverted. We look into a lot of other social websites, get more and more of informations and rumors. You get more of statistics, so it's showing that these people, this many number have been affected. Then again your fear and anxiety stress becomes more and more. So no other go, you have to. Next slide please. Work related factors that add to stress apart from this is concern about the risk of being exposed to the virus at work. So many of them have got work from home, taking care of personal and family needs while working. Apart from that, so there are two things. When you are at home, you will concentrate only to the family, and when you come to the work, totally you will be concentrating on the work. Lot of when you come to the work, but when you are taking care of work from home, what happens is you have to work for your office, work from home, and also work for home also. So taking care of personal and family needs while working. Apart from that, you will be disturbed, you will be asked to do many things. So many of them has faced that they're not able to concentrate completely on the work. A lot of diversion takes place when you're at home. You have to keep moving around, you've been expected to do something at work. So managing a different workload, it is entirely a different scenario, working a different workload at home, both work and for also the home also. Lack of access to the tools and equipment needed to perform the job. So as we all know, even in the nursing field, we know that since we are a lot of skills we are lagging. What happens is, being at home, uh, taking online classes, we are not going to we are not able to provide the hands-on skill. So we are lacking a lot of things which you are supposed to do at the lab. So lack of access to the tools and equipments needed to perform that also creates a stress in the individuals, and also what is need to be performed. Work related factors that add to stresses: feelings that not contributing enough to work, or guilt about not being on the front line. One is that, and the other one is uncertainty about the future. All of us, we are not, this totally has become unpredictable. What is going to happen, we don't know. We would have the pre last week would have spoken to one of our family member or a friend or some of our distant relative or friend. Now you would have heard that they are no more. It becomes an uncertainty one, and uncertainty about the life, and also we don't know how it's going to be about our future or about our employment. Uncertainty about the future employment, and then learning new tools. Why is this future unemployment? Certain people have started taking up work at home, and they feel so comfortable being so. Whether it's going to happen continuously like that, or we will be called back to the work. One is that, and few organizations, they would have said that time being we are getting close, we'll call you back again for the work once it is reopening. We don't know whether then there will be again a query whether, or fingers crossed, like whether we'll be called back again for the work. Learning new tools and dealing with technical difficulties. Many would have not had the habit, or would have not worked with the screen or with the gadgets to work. Now all have to see, many of us have their mobiles and take the classes online. Think about the people in the poor economic background, how they are going to handle these situations. How are we going to, I've heard many houses, they brought a lot of mobiles. Each and every child is having a mobile, so that to take the classes, online classes. And they don't know, many of the parents were not aware how to use with this laptop and all those things. So learning new tools and dealing with technical difficulties, adapting to a different workspace or a work schedule, because it is entirely at home. You have to get ready yourselves and sit in front of the system at home, which may not be comfortable. Next is common symptoms. So what are the common symptoms of the stress? This is the common symptoms, as I said, all these about the work, about the loss of job, or the financial, taking care of the home, or taking care of the dependents, family dependents, all those things creates the stress. So what are the common symptoms of stress? Stress is a normal part of life. It is a natural response to external pressure that disrupts the equilibrium. It often causes symptoms such as sadness, confusion, irritability, anger, uneasiness, and suicidal thoughts to the extreme. So these are the main symptoms. Reduced concentration, efficiency, and productivity. You will not be able to concentrate. you don't have lot of loss of sleep, loss of the sleeping pattern is altered, loss of intake, proper intake would have not been taken place, so thereby leads to a lot of less concentration on the work. When you less concentrate, the efficiency and the productivity becomes less. Thereby there will be a call from your job saying that this work is not done, that is not done. Then you later it ends up in unemployment, thereby which leads to sadness, confusion, irritability, anger, uneasiness and suicidal thoughts. And apart from all those things, social withdrawal and isolation, which are the main symptoms of the stress. Next slide, please. Other symptoms are interpersonal problems. Interpersonal problems, you may argue or fight or quarrel with your the closed ones. Tension takes place because of all the stress about the job, thinking about the job, or how are you going to manage the family. Mainly with this, or with the adolescents and the children not able to go out, all this attention takes place because of all those things. Body pain, reduced energy, sleep problems, eating problems takes place. Next slide. Next slide. So the previous slide, please. Previous slide. Yes. So how are we going to cope up with this stress? How are we going to come out of this stress? How are you going to face this stressful situation? Which is very, very important is resilience. An important term. Resilience is how are we going to overcome this? Resilience is the thing which we use or to overcome this, or to come across this hardship. So resilience can help us get through and overcome this hardship. But resilience is not something which is born with us, but we have to build within us. That is called as resilience. So we have to use this resilience to come out of this fear and anxiety and stress. Next slide. Next slide, please. This is a diagrammatic representation of using up for this resiliences. There are two things. One is the negative outcomes and the positive outcomes. Here I mentioned about the negative outcomes as job loss, loud one with COVID-19, physical distancing, closed schools are the negative outcomes. Think about the positive outcomes are unemployment benefits, responsive relationship, stable housing. Here there is a fulcrum where I put it has shown the negative outcomes are down and the positive outcomes are shown up. Next slide, please. Next slide, please. How are we? These are the ways to build the resilience. First one is how are we going to build this resilience? First is pull down this negative side, unload the negative side. How are we going to unload this? Reducing the sources of stress. We have to unload the negative outcomes like job loss. This is not going to be permanent. This is only a temporary. That is how we have to take up. So unload the negative side. The negative side is the job loss. Loud ones with COVID-19. So job losses, it's not going to be permanent. It's going to be temporary. This physical distancing is to protect ourselves to not to get affected with COVID-19. Closed schools also, it's going to be temporary. It's not going to be permanent. Loud one with COVID-19 could be taken care and they can be protected, and they're going to revert back to us unless and until they are with some sort of comorbid conditions. And with all these protective measures to be taken in order to getting faced into, or if you have already faced with COVID-19, so unload the negative side. The next slide, please. That unloading the negative side will reduce the stress. The second one is load up the positive side. Loading up the positive side is with supporting a responsive relationship. Now you would have a lot of time to spend with your family members, with your loved ones, or with your children. So have a responsive relationship. Understand the partner or understand the family members. What are their needs? How are you? You would have not had time. There were days where you would have not had time to spend because people who are working or who are going for work and all going for work, majority of their time they spend in their workplace. workplace. So morning you get up, get ready quickly, you have to pack your food and then go for work. Evening come and prepare in the night, or you have to think about the next day's work, how are we going to make. But this is the right time where it is a created opportunity to spend a lot of time with your family members and with your dependents or with the children, understand them, get to know about what do they feel, how are they performing, how were they doing. So this will be the right time. So responsive relationship, suppose if married people, help your wife at home, or understand what is needed for the husband, and each of them help each other at home, and get to understand the things, and so that the relationship goes smoother. Unemployment benefits, these are the benefits layer where you will have time to understand what is happening at home, and stable housing, being at home. So supporting responsive relationship is going to is the positive outcome which you have to load it up. Next time, strengthening the core life skills is the third move of the fulcrum, which is the core life strengthening is like understanding about the loved ones feelings, get to know each other, do the physical activity more, eat healthier food, all those, these are the strengthening. So the third one is core life strengthening the core life skills. So that is the fulcrum. Next slide please. So ways to overcome the stress. How are we trying to overcome the stresses? One is the very, very important thing is first is care for physical health. Manage what you can, and release what you cannot. Think about what, don't grumble about, or keep bugging about, like it happens only to me. I don't know. I'm unlucky. It happens only to me. It doesn't. Certain things it'll take time. Certain thing it'll be getting delayed. Don't keep worrying, or keep bugging about things, or don't keep talking about things which is not happening, or which is you are not able to do. You think or talk or do what you can do. So manage what you can. Know your limits. Certain things, suppose you are able to go for your walk within your house, you go for your walk. That is the limit. I'm not able to go for a jog, but you can go for your work. You will be able to do certain exercises at home, do it. So know your limits and do that. Practice the self-care. Maybe there are not time to take care of yourself when you're going for a work or in a busy schedule, but it's the right time to practice your self-care and take care of yourself. Next slide please. Care of the physical health, get enough sleep, try to go for the bed in the right time, participate in the regular physical activity. As I've already mentioned, if it is possible to do some certain exercises at home, try to do that. Because nowadays I've seen many people started looking into the YouTube, or there are apps which teaches you certain exercises which you can perform at home. And I have seen there are people, the whole family members together, they start doing the exercises, or individually they practice the exercises. Go when you do the regular exercises and eat healthy food, you will get your sleep proper in a proper time, and you go for in a proper time. So get enough sleep, participate in regular physical activity, eat healthy. Next slide. Avoid tobacco, alcohol. You know that which has to be avoided. What are your limits? What can be avoided? What should be taken and what not to be taken? Avoid limit screen time. Avoid the there. I will not say that never touch it, but you will use it, but try to avoid it. Start mingling, because I've said you this is the right time for you to mingle with your family members. Talk with your family members. Limit your screen time. Relax and recharge yourselves. Play some games. Talk, enjoy. Tell some jokes. Relax yourselves. Enjoy some nice movies which is of a comedy or something, or all those things. Keep calm and carry on. Don't think about which is going to stress yourselves negative, or which is going to be. Sometimes what happens is when you keep quiet or isolate yourselves, a small move or a small pain also, it'll bother you more. You feel that pain will be dominant, even though it is in a very minimal form, or it's a very milder one also, that will be dominating more for you when you're getting isolated, or when you're very silent, or when you're isolating yourselves even inside the room. So keep calm and carry on, relax and recharge yourselves. Then the immunity boosters are very, very important during this time. How I told about eat healthy, include more salads, probiotics, proteins and vitamins in your diet to make yourselves ready to fight against it, because immunity is very, very important. But many people who are having a very good immune system are not being affected with, so to keep ourselves and your immune system boosted, include all these of more of salads, probiotics, proteins and vitamins in your diet to make yourselves ready to fight against the deadly virus. And very, very important thing is practice yoga. If you are not, I've seen people who have not know anything about yoga, who have not heard about yoga, also started practicing yoga, seeing the YouTube. There are apps, there are teachers who have started doing online classes, practice yoga and all. So yoga, being an art of balancing the body, mind and soul, has a power to, previous slide please, uplift the physical health, emotional balance, and this is very, very important, which balances all physical health, emotional balance, and mental wellness. So, recommend you all to practice yoga. Next one. And also, I didn't mention about this pranayama on this breathing exercises. Then keep your regular routine. Not say when I talk about the regular routine, what happens is you will be able to complete your work of day-to-day activities. You'll be able to finish it off in time. What happens is when your sleep gets altered, you'll be getting up late, your eating pattern gets altered, so all those things will get affected and certain works will get it. Keep your regular routine, limit exposure to news media. This is, I'm talking about the care of mental health. What happens is when you get more and more exposed to, or people talking more and more about COVID, or about the loss of loved ones, or about what are the negative aspects, what we hear, the negative news and all that. So it gets more and more bucked up. So certain people, so certain friends, when I speak about, no, so they start talking about COVID. Sometimes they themselves let us not speak about it because it bothers me more. Because many of my close friends or my relatives have passed away due to, so when they start talking about it, they feel so bad, so they themselves they cut short. Few people doesn't want to talk about it at all. I know how to take care of myself. I take a lot of preventive measures. That's it. You talk something like let us laugh, or let us smile. Talk something which keeps us smile. So limit exposure to the news media. Stay yourselves busy. That's what I told you. Keep your regular routines. Focus on positive thoughts. Use your moral compass or spiritual life for support. If you are very spiritually active, then set priorities. What is important? I've already told you, give importance for the physical activities, give important what is possible from your end, and sitting at home can be done, that you can do it. Next slide please. Connect with others. How are we going to connect with others? Make connections is not that just going out of the house and talking with your friends and then getting COVID and coming back. It is not that. Talk to your friends for a time. During this lockdown, many people have come out with a lot of good ideas, positive thoughts. How during this COVID, this social isolation, or during this lockdown also, how positively can be connected with people. If you feel that you're going to miss your friends, or talk to them over phone, have a chat with them. I think many of the family members, they don't meet each other. They only talk to over a video call, or talk to them over phone for a long time. Do something for the others. What is it? Do something for the others is, as I was mentioning it, there are people with low socioeconomic background, or people on the streets, people are homeless, people who are daily wages. They don't even have time. They don't get money to take their one meal per day. Think about how are they going to get their mask? How are they going to get about that? If you are able to do something for them, do something for them. Support your family members or also friends. Next slide please. Getting help from others. How are you going to get help from others? Asking for help from others is, like, example, if you are been struggling with some sort of problem, or with how I'm going to like, I'm totally stressed up, I'm not able to come out of it, how I'm going to take help? Seek out grief, counseling or mental health services. Seek spiritual support from faith-based organizations if applicable. There are many faith-based or spiritual supports are given over telephonic. through telephone or the mobile conversation is being done, the prayers are done over phone. Seek support from other trusted community leaders and friends. Next slide. Next slide, please. And ways to support the children and adolescents. Inform the children regarding the outbreak. Many children may not be thinking in certain WhatsApp jokes also I have seen. So Corona is a festival, so children are enjoying this festival like leave long term. Children are enjoying, but you at the same time you should make them create an awareness in children what is happening, what is this pandemic, how they have to protect themselves. Inform the children why are not being sent out for playing. Inform the children regarding the outbreak. Answer the questions and share facts about COVID-19 in the way that child can understand in a simple language how they can protect themselves. And don't threaten them, but they should be aware about it. They should also understand the importance of the preventive measures. Reassure your child that they are safe. As of now, nothing has happened, but still they have to keep themselves protected. Share with them the ways to cope with the stress. It'll be very stressful for them because they are at home. They are being we keep holding them at home, not sending them out of the house. So what happens is it will be stressful or bothering them a lot, and a lot of the physical activities have come down. So I have seen many of the schools even have conduct the physical education class through online. They open it online. They ask them to get up and do certain exercises or do some yoga practices. That is a very good move. And you also keep as a family member or as a brother or as a sister, keep motivating the children to do some physical activities or teach them certain physical activities or household activities. When the physical activities are less, which is being done outside, they can do the physical activities or work which they have not learned. Teach them some household activities or how to sweep a house or a mop or do some certain activities, small activities which they can also learn. Next. Ways to support the children again is limit families' exposure to news coverage of the event, including social media, which I've already mentioned. Children may misinterpret and can be frightened about something they do not understand. So make them understand in a simple, understandable language. Get them show certain pictures, not showing them all about only the death news. Try to keep up with the regular routines. If the schools are closed, create a schedule for learning activities, relaxing or fun activities. Try to avoid the limit their exposure to the screens maximum apart from their school or the activities which has been taken classes during online. Apart from that, because apart from the classes still they'll be sitting with the video games or something with the mobile, some certain games. Be a role model, take breaks, get plenty of sleep, exercises, and eat well. Connect with your friends and family members. Spending time with your children is meaningful activity. Reading together. Most of the children in the family, when apart from this COVID-19, they would have been lacking their support from their parents or the parents who both father and mother who are working. No, they will not have time to spend. They would have not had adequate time to spend with their children, not to get to know what is happening in them. Many parents know what the children is doing, whether they're studying well or not, what is happening then, what is needed for them. So spend time with them. Many children want their parents to tell some stories or talk to them and all. No, they don't have time to do all those things. So exercise, playing board games, which will be helpful for them to support. Next slide. Apart from all those things, raising your self-esteem is very, very important. Self-esteem is very important. Self-esteem can be raised only with adequate support system and also talking only about the positive things. This, which is not mentioned here in the slide, but still self-esteem, raising your self-esteem will definitely keep yourselves keep positive. So raise your self-esteem, which is very important. Don't try to put your self-esteem down by talking about the negative things or things which has not happened to you earlier. definitely things will happen in in a good way. Let me know if, when I say the positive, about the positive mental health, not about the COVID positive. Then next is stress and stigma. Why I'm talking about the stigma is people who have been diagnosed and been treated and come out of COVID, they'll be have stigma. This person, this house is, there are two people who have been diagnosed with, have been treated with COVID and they are being back to home. So few people, they doesn't want to cross the street also, or they doesn't want to stand in front of that house also, thinking that they all will be affected. So stigma is a discrimination against an identifiable group of people, a place, or a nation. So stigma is associated with lack of knowledge about how COVID-19 spreads, a need to blame someone, fears about disease and death, and the gossip that spreads, rumors and myths. What happens is there will be a health professional who will be clearly explaining or describing about how you have to prevent yourselves, protect yourselves, wash your hands regularly, put your mask, distance yourselves. Apart from all those things, a lay person or a vendor or a street person who's nearby, or a maid who talks about something, that will be taken more. Kindly understand, they're all we would have got a proper information from a professional health professionals. Try to follow that. What happens is unnecessary gossips, unnecessary rumors and myths which has been provided, which will create more of stress, and that will create a lot of fear and anxiety and a lot of stress. So fear and anxiety about a disease can lead to social stigma, which is a negative attitude and belief towards people, places, and things, which will reduce their self-esteem. Kindly avoid getting into this gossips and spreading rumor and myths. Don't keep on reading about the informations or about the social media. Get to know as a small information for the day to know about what is happening, but not keep on talking about it, digging about it, talking each and everyone. There are a group of people who keep talking with everyone, talking about all the rumors and myths and passing on to each and everyone. That will create a lot of fear and anxiety, which will create a negative attitude. Thereby, your self-esteem will come down. So stigma can also happen after a person has recovered from COVID-19, been released from home isolation or quarantine. Sometimes earlier in the first wave, they used to put a seal on the arm. So what happens is when they see the seal, people will run away from the place, or people who are moving from one place to other place. So kindly take care of all those things. Don't be so these things. Understand what is the reality and try to protect yourselves, which will all keep away from this fear and anxiety. Fear and anxiety will be there, but not to the extreme of where you are not able to cope up, or extreme level of stress. Next slide, please. Next slide. Next slide. People who may experience a stigma are certain minority groups, people who tested positive for COVID-19 and recovered and were released from quarantine, emergency responders or healthcare providers. There are volunteers and healthcare providers are there who immediately help the people who are in need of help for the people who are in an emergency situation. Other frontline workers, even the nurse at the hospital or anybody frontline workers who come out of the hospital, they doesn't even wanted to talk to them, go in front of them, come across them. So they all may experience a stigma. People who have difficulty in following recommendations, people who have underlying health conditions that may cause a cough, as it may be an ordinary cough or some other conditions which may be triggering the cough, will also, anyone coughs, anyone sneezes, they say that this person may be experiencing COVID. So people living in congregate or group settings, such as people experiencing homelessness, so these people may experience a stigma. Next slide, please. Ways to prevent stigma: maintaining the privacy and confidentiality of those seeking healthcare, those who may be part of any contact investigation. Immediately people say, I may be, certain people who may not open their mouth also, even they have been having signs and symptoms. You shouldn't be like this. If you feel that certain signs and symptoms, need to be taken necessary steps to get to know, If you are not, if you're being tested negative, it's well and good, but still maintain your health. If you're being tested positive, take necessary actions to take care of yourselves. Quickly communicating the risk or lack of risk from contact with products, people, and places. Then you should know who is being affected, who are now, like how we are to protect yourselves and from the places, products, and with the people. Correcting negative language that can cause a stigma by sharing accurate information about how the virus spreads. That's what I was keep on telling throughout. You get to know only the actual or realistic informations, the informations which are true, not carrying the myths or the rumors. Next slide, please. Speaking about against negative behaviors and statements, including those on social media, making sure that images used in communication show diverse communities and do not reinforce the stereotypes. Thanking healthcare workers, responders, and others working on the front lines, suggesting virtual resources or other social support services for people who have experienced stigma or discrimination. Are these things to be taken care in order to prevent the stigma? Next slide. Previous slide. Previous slide, please. Previous slide. No, not the next slide, the previous slide. '41, yes. The moral injury from COVID-19 crisis is healthcare workers on the front lines also may feel responsible for the death of others during a pandemic where impossible choices need to be made about distribution of life-sustaining equipment. So this is very, very important. See, there are people saying that, why are you not? I don't mind anything happens to me. Let it come. I'm ready for that. We don't mind that however you go, but you should not spread the disease to others. That is what we request you all, to protect yourselves with a mask. So hospitals may be there, frontline workers are there. You need to take care of yourselves first. Life sustaining equipments are also there, but still we don't want you to take you to that extent. Given the shortage of ventilators for those who need them, healthcare workers are left to bear the burden. You need to think about what the lacuna is also. We know that so many are being diagnosed, that many facilities we don't have. So it has been a burden for these decisions, but simultaneously putting on their own lives at risk. So as I've said, you may not, you may feel that anything can happen for you, but we are not bothered about that. But we should take care of ourselves, see to that we don't spread to others. And because when you keep spreading others, what happens is, there, as I've said, frontline workers, there are a lot of people working for that. We have lost even the frontline workers also. A lot of equipments we are lacking, oxygen supply we are lacking. So all these things we need to prevent, we need to protect each and everyone. We need to treat so many people also need to be taken care. This is the moral injury which we need to learn. Next one. Symptoms of moral injury include demoralization, inability to self-forgive, guilt, shame, and self-punishing behaviors. Why this happens to me? Few people will not come out. Few people wanted to die. Few people wanted to punish themselves. So healthcare workers may struggle with the feeling like their morals and values conflict with the choices they have to make during this pandemic. Terrible thoughts and images may continue to haunt them. What happens is, there are in many hospitals, I've heard people who are above 80, they have told that anyway I have crossed 80. I don't want this ventilator and oxygen supply. Give to someone who is suffering with out of age of 20 or 22 years, who has to live long. So we have heard in many social websites stating that many of the elders have given up like that and they have lost their lives. Moral injury can happen both from actions and inactions too. Next slide, please. Moral injury from COVID-19 crisis Recognize moral injury and associated grief. Importantly, this pandemic will not only take a physical toll, but a tremendous psychological toll it has taken up. That is what we are speaking for the day today on stress and fear and anxiety. Many people have developed into with mental health problems also because they would have lost many of their. There are many children who have lost their parents, both father and mother. There is no one. They are homeless. They don't have family now. Even recently we have come across nurses, there are news that many children, if you wanted to take like take care of the children, if anyone is willing to adopt them, you can come forward. So frontline workers may experience numbing, compassion, fatigue, and secondary trauma because they're seeing many cases where they're helpless. They're trying to do maximum for the patients, but they're not, but they're helpless in certain situations. So they feel they're also feeling a lot of stress. So how are we going to overcome? What are the ways to overcome these feelings of moral injuries? First one is take a pride in taking care of yourself and others. As I keep on mentioning, first take care of yourselves. You would have got a lot of information about how to take care of yourselves, protect yourselves, and then pay attention to feelings and keep up with social activities as much as you can by avoiding or spreading the wrong news or the myths. Even when uninfected ourselves, we are at risk. If you're not infected, you're at risk, but still you need to take care of yourself. Be gentle with yourselves, be compassionate to yourselves, be kind and involved in enhancing the self-care activities. As I've mentioned, you would have not been taking care of yourselves, you have not been bothered about yourselves for these many days. If you have not done it as of now today, please take care of yourselves, because you may not be bothered about others. We need to be bothered about others. Others we should not spread to others. So all these, when we start doing this, automatically the prevalence rates comes, so the fear and anxiety will come down. Ways to overcome the feeling of moral injuries: find ways to do physical activity, as I've mentioning, and abundance of longer practices on the web apps to do at home, or deeper restoration. I've told you many apps have come out to divert, many online classes to divert yourself in engage in certain activities, yoga classes, physical activities, cult programs, just exercises being taught, and then yogas of different types, variety of practices to reduce mental and somatic pressures. Even there are apps to tell that how do you come out of it. So many people practice that. That can be done online. Explore these and see what you love, and you can do it. You get engaged in what you like more. You are interested in music, you do play a piano or a keyboard, or you keep improving those activities. You have the habit of painting or drawing, getting involved in it, because you have time now to get more time to get involved, improve in those activities which you like more or love a lot. Focus on aspects of your life that you can control over the right now, and which is important. You would have thought certain things which I am not able to do because I don't have time. Now you have time, you can even have time to concentrate on that, in improve those activities. Next slide. So what are the general measures to maintain health during COVID-19 is, this is, you'd have heard frequently, but once again, I wanted to emphasize it. When you do all those things, you will be able to keep away from this fear and anxiety. Wash your hands often with soap and water for at least 20 seconds when you go out, when you come when you get inside the house, and then when you touch something, especially after blowing your nose, coughing or sneezing, going to the bathroom before eating and or preparing food. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Cover your mouth when you cough, sneeze with a tissue, then throw the tissue in the trash. See to that all these are being taken care. Next slide, please. Most people have mild illness and are able to recover at home. If you think you may be able to expose to COVID-19, contact your healthcare providers. Keep track of your symptoms. keep your experience, you experience any emergency warning signs, get emergency medical care immediately, protect yourselves with a mask, which a prescribed mask, uh, when you go out, and then take the sanitizers. Or if you don't have sanitizers, when you go out and come in, you see to that, when you don't have carry sanitizer, see to that you don't touch your eyes or nose or mouth with your hands. Come back, wash your hands thoroughly, and take these other protective measures which has to be taken care for yourselves, and keep preventing spreading to others also. That is about taking care of yourselves. The second thing is, you need to the self-esteem has to be raised by the positive thoughts, positive talking, prevent speaking about or talking about the rumors or spreading the rumors. And then eat healthy, keep up your physical activity properly, do your exercises regularly, have a positive thought, unload your negative side, improve or upload your positive aspects, keep improving, do the activities which love yourselves, in doing those activities more, and spend yourself time for more, avoid keeping yourselves in front of the screen for long time. I think I've told about how you have to keep yourselves in preventing yourselves from getting more and more of fear and anxiety, and in order to overcome the stress also, which is very very important, is resilience, which I wanted all of you to follow. Resilience is a very important technique which all of you need to, that I've told you what are the steps to need to be taken during this resilience. So I hope I've been I've talked or given information about what is needed. So with this, I think I've completed. And if you have any doubts, I'll be happy to take up the questions and answer for you. And any questions or any doubts is welcome.
Thank you, ma'am, for your valuable speech. And I would like to ask from the participants, if you are having any confusions, you can ask.
If you have any doubts, you can ask.
Any questions? The chat box.
I take this opportunity to thank our the chairman of Columbia Group of Institution, Mr. Subramani Reddy, Principal Dr. Dinesh Selvam, the staff, and the special thanks to the Department of Psychiatric Nursing for giving me this opportunity and the platform to talk on this topic, which is very, very important on this COVID stress management. I feel I have done justice to the topic given to me. Thank you so much to the staff, and thank you, Principal Sir, for giving me this opportunity too.
Thank you, madam. Thank you. Next, Fiba.
Yes, sir. Good afternoon to all present here. It's such an honor for me to get the opportunity to thank all dignitaries. On behalf of the Psychiatric Nursing Department, Columbia College of Nursing, I would like to express my gratitude to all esteemed delegates of the webinar for their presence and contribution to make this webinar a great success. Extend my gratitude to our respected resource person, Dr. Sharmila J., Principal and HOD College of Nursing Sciences, Dayananda Sagar University, for sparing your valuable time for us. Thank you, ma'am, for enlightening us with your commendable talk on the subject post-COVID stress management. Today's webinar was full of knowledge and it gave deep insights into the topic. I'm pretty sure the precious knowledge that Dr. Sharmila gave us will definitely help us in our current situation. Once again, I would like to thank Dr. Sharmila J for taking out time from her busy schedule and enlightening with the knowledge. Thank you so much, ma'am. I also express my heartful gratitude to our respected chairman, Mr. S.K. Subramania Reddy, Secretary, Mrs. Usha Reddy, and Director, Mr. Raghunath R., for giving permission to organizing this webinar session. A special thanks to our principal, Dr. Dinesh Selvam S., and Vice Principal, Mrs. Radhika K., for the immense support and for organizing the webinar. I would like to thank Mr. Anjan and Mr. Rahul for the technical support. Last but not the least, I'm thankful to all the participants for joining and made this webinar a great success. Once again, I thank all of you for your presence and thanks for joining.
Thank you all. We will wind up.
Thank you all.
Thank you, madam. Thank you.